Hi everyone, my name is Kylie Coronado and I'm an LPN to BSN student at Indiana State University. This is Community Health Nursing 444 and this is my health education program. Within this education program, I'm going to be talking about the population at risk for the COVID-19 virus that is currently affecting our globe right now. This population includes the elderly, those that are immunocompromised, pregnant, homeless, and those in the jail population. For this health education program, I wanted to explore the individuals that fall into the category of the at-risk population for the globally spreading novel virus COVID-19. I'm going to explain what this virus is, why it is attacking such a vulnerable population, and the effect it's having on our economy right now. The goal of this health education program is to spread awareness of the fast-growing pandemic and to outline those who are at risk and the steps that everyone should be making to keep themselves and the public safe. Now let's take a moment to pause this video and complete the pretest that was provided. Okay, now that the pretest has been done, let's take a moment to talk about the population at risk. And let's talk about exactly what COVID-19, also known as the coronavirus, really is. And I'm sorry, no, it has nothing to do with the beer Corona, as many people seem to be thinking. The coronavirus originated in China at the end of 2019, hence the name COVID-19. It has been a very fast-spreading virus since it became known in December of last year. The target population affected appears to be the elderly and those with chronic illnesses. As of March 20th, 2020, there have been 272,056 reported cases and 11,299 deaths from the COVID-19 virus. 90,618 have recovered from COVID-19. Now let's take a moment to review some pathophysiology of coronaviruses. They are a large group of viruses that come in many different types. The virus itself contains genetic material encased in an envelope with protein spikes that give it the appearance of having a crown. The Latin name for crown is corona. This is how these different viruses get their name. The different forms of coronavirus can cause symptoms in the respiratory tract and the gastrointestinal tract and have not had serious effects on individuals thus far. In the milder cases, some might have an upper respiratory thing going on, like a cough, normal flu things. In the GI system, they may get nausea, vomiting, diarrhea, other things that happen to everybody every day. The coronavirus circulates within humans and animals, but the two generally do not cross between. In some cases, this transmission does occur, and it causes serious disease and illness. Some forms of coronavirus that have crossed over into that severe disease category include the SARS of 2002, MERS of 2012, and now the novel coronavirus of 2019. And this virus is believed to have originated from bats in China, from the markets with all these animals that they have in cages. They're all being sold, and so a bat might have carried this virus and it gave it to somebody else, a human that is, which then has now created this worldwide pandemic. So what exactly is COVID-19? It's a virus that has attacked the respiratory tract. It originated in Wuhan, China. It's spread from being in close contact with a person who has been infected. The virus is said to have come from an animal source, as we just talked about. Healthcare workers and those living closely with one another are at the biggest risk for transmitting between one another. The most common symptoms of coronavirus include a fever of 100.4 or greater, a cough, and feeling short of breath. There are other milder symptoms that some have reported, but the most common ones are these three to look for in combination with one another. So for this health education program, the main focus is the population at risk. And the population at risk are the elderly population over the age of 60, those who are pregnant, and those with chronic illnesses and conditions such as high blood pressure, cancer, diabetes, kidney disease, and other respiratory conditions such as COPD, asthma, and such. There is another population that is at risk for COVID-19, and that is the homeless population. Their access to resources is very limited, and getting the appropriate help when they are sick is not always there for them. So they may have all of the symptoms and go around the public and infecting everybody else, and they don't even know it. So without proper treatment, this population puts all the others at risk. And they are in the public, coughing and riding the bus, staying in shelters with many other people. So this population, I think, is another growing at-risk population for this pandemic. Another population at risk is the jail population. This population is generally in close quarters with one another, and they don't really have the space to do the social distancing rules. So right now, the jail population is at risk for COVID-19 if somebody was to be infected with it and then pass it around to others. So what are the best ways to prevent and slow the spread of this virus? Practice safe distancing and limit going out as much as you can. Wash your hands frequently with soap and water, and if that's not available, use an alcohol-based hand sanitizer with at least 60% alcohol, and avoid touching your face with your hands. If you're sick and you have a fever, stay home. Those with family members who are at risk population should be extra careful and more diligent about these precautions. Wipe down surfaces frequently with sanitizing solutions such as wipes or bleach, and if you are sick, wear a mask to protect others within your family. Right now, there is no cure for COVID-19. Doctors and healthcare workers are treating the symptoms for these patients. They are put in negative pressure isolation rooms, and the staff must wear airborne precaution PPE equipment. COVID-19 has not only affected China, where it originated, but it has severely impacted Italy and is moving fast across the globe. And the virus has begun spreading within the United States over the past month or two. According to CDC, it has hit the hardest in New York, Washington, and California, all of which have international airports and are very large and busy international airports. Here are some resources if you want to learn more about the COVID-19 pandemic. These are some great websites if you want to learn how to protect yourself, your loved ones, your coworkers, and anybody within your community and neighborhood. I highly suggest that everybody watching this video take a look at them, especially with everything going on right now. We really need to take the steps in the right direction to protect our vulnerable population at risk. It is up to us, the healthy individuals, to protect these people. So we all really need to make the proper steps during this very hard time. So please, everybody, do your part to protect our population that is at risk. I know we all have loved ones and some that are elderly, and they are more at risk. So we should do all we can to protect them, those of us that are healthy. I hope this was educational for everybody. It's a crazy time right now. I know there's a lot of information out there and lots of websites that you can go to, but I wanted to put something together to kind of, break down what's going on and give a quick overview in a more simpler way. So I hope everybody enjoyed it, and thank you for watching. And here are my references. Thank you again for watching, and I hope you guys enjoyed.